Imagine starting your day like any other. You wake up, step into the shower, and begin your usual routine. Then you notice something slightly different. Maybe it's a small lump. Maybe the skin on your breast feels a little thicker than usual. Or maybe it simply looks different. Most people brush this off. They tell themselves it's probably nothing. But for thousands of women every year, a small change like this becomes the first warning sign of breast cancer. And the difference between discovering it early and discovering it too late can literally save a life. In this video, we'll talk about the early warning signs of breast cancer, the subtle symptoms many people miss, and the things doctors wish more women knew sooner. Some of these signs are surprisingly easy to overlook, and recognizing them early could make a life-saving difference. Before we look at the warning signs, it's important to understand why this topic matters so much. Breast cancer is one of the most common cancers affecting women around the world. Every year, millions of people receive this diagnosis. But there is encouraging news. When breast cancer is detected early, treatment is often much more effective and survival rates improve dramatically. Early detection gives doctors more treatment options and increases the chances of a full recovery. Unfortunately, many cases are discovered later than they should be, simply because the early signals were missed. Number 1. One of the most well-known signs of breast cancer is a lump in the breast. However, not every lump is cancerous. Many breast lumps are actually benign, which means they are not dangerous. Still, doctors pay close attention to certain characteristics. A lump that may be concerning can feel hard, irregular in shape, and different from the surrounding tissue. Some people describe it as feeling like a small pebble beneath the skin. Others notice that the lump doesn't move easily when touched. But here is something many people don't realize. Some breast cancers do not create obvious lumps at all, which means relying only on this sign isn't enough. Number 2. Another important change to watch for is a difference in the size or shape of the breast. While breasts are rarely perfectly symmetrical, sudden changes may signal something unusual. One breast may become swollen, enlarged, or slightly distorted. Sometimes these changes happen slowly. Other times they appear quite suddenly. Because these changes are often painless, many people ignore them. Before we continue, take a moment and ask yourself something honestly. When was the last time you really paid attention to changes in your body? Many people avoid conversations like this because the topic feels uncomfortable, but awareness saves lives. If you found this helpful, hit the like button, subscribe to the channel, and share this with someone you care about because the right information can change someone's life. So stay with me until the end of this video. Later, we'll talk about the silent warning signs doctors say people miss most often, and one simple habit that could help detect breast cancer earlier. This information could help protect your health, or the health of someone you care about. Number 3. Breast cancer can also cause noticeable changes in the skin. You might see redness, thickened skin, or dimpling. Some people describe the skin as looking similar to the texture of an orange peel. This condition is known as peau d'orange. It occurs when cancer blocks the lymphatic vessels beneath the skin. If the skin on the breast suddenly changes in texture or appearance, it should never be ignored. If you found this helpful, hit the like button, subscribe to the channel, and share this with someone you care about because the right information can change someone's life. Number 4. Your nipples can also provide early clues about breast health. Possible warning signs include nipple inversion, unusual discharge, persistent pain, or scaling and flaking skin. If a nipple that normally points outward suddenly turns inward, it may be worth getting it checked. Similarly, discharge that appears without squeezing the nipple can be an important symptom. Number 5. Many people believe breast cancer always causes pain. In reality, most breast cancers do not cause pain in their early stages. However, ongoing or unexplained breast pain that does not follow the normal menstrual cycle could signal that something unusual is happening. Pain alone is rarely the only symptom, but when it appears together with other changes, it should be evaluated by a healthcare professional. Number 6. Another area to pay attention to is the armpit. Breast tissue actually extends into this region. Because of this, breast cancer can sometimes spread to nearby lymph nodes. Swelling or lumps in the armpit may appear even before a lump is felt in the breast itself. That's why doctors often check lymph nodes during breast exams. Number 7. While breast cancer can affect anyone, certain factors may increase the risk. These include family history, age, hormonal influences, and some lifestyle factors. But here is something important to understand. Many people diagnosed with breast cancer have no family history at all. That's why regular screening and body awareness are so important. Medical experts around the world agree on one powerful message: early detection saves lives. Screening methods such as mammograms can detect tumors before symptoms appear. In many cases, these tumors are found when they are still small and easier to treat. Regular screenings and awareness dramatically improve outcomes. There is one simple habit doctors strongly encourage. Become familiar with how your breasts normally look and feel. This doesn't mean checking obsessively every day. It simply means understanding what is normal for your body. When you know your body well, you're much more likely to notice changes early, and acting early can make all the difference. Behind every statistic is a real person. A mother, a sister, a daughter, a friend. Many breast cancer survivors share a similar story. They noticed something small, something easy to dismiss, but they chose to get it checked. And that one decision changed everything. While no lifestyle can guarantee prevention, certain habits may support overall health. Maintaining a healthy weight, staying physically active, limiting alcohol consumption, and eating a balanced diet can all support long-term well-being. Healthy habits don't eliminate risk, but they can contribute to better overall health. Your body communicates with you every day. Sometimes those signals are quiet. Sometimes they are easy to overlook. But listening to those signals can protect your future. Awareness isn't about fear. It's about empowerment. The more we understand our bodies, the better we can care for them. If you found this information helpful, consider sharing this video with someone you care about. You never know who might need this message today. One conversation, one early checkup, one moment of awareness. Small actions like these can save lives. Stay informed, stay aware, and most importantly, take care of your health.